services in the UK and the UAE. What has been my main forte on trying to develop services in these countries is to look at innovation and look at patient-centric care. Both of these are most essential for any services to be developed in any part of the world. You need to make sure your services are meeting the actual needs of the patients in the community and are led by evidence-based and innovative care models. Also trying to make it cost-effective, which also is able to meet the needs of the system and the patient themselves. Third International Psychiatry and Masterclass is covering a number of topics, including psychedelic treatment, ketamine treatment, as well as long-acting injection buprenorphine within addiction and mental health. In the next 5 years, I see new innovative medications coming out to help with mental health. As we mentioned earlier, psychedelics possibly playing a more evidence-based role and helping people with mental health, as well as medication being available in a depot form. And an injectable form, which is a game changer, particularly for substance misuse clients. Where coming to a pharmacy on a daily basis to pick up their medication was not only full of stigma, but was also a hindrance for them to get back to their routine life. So any form of depot treatment, which gives them weekly and monthly preparations, not only improves the clinical outcome, but also the quality of life. So in short, more innovative treatment coming out, I see in the next 5 years, including more and more depot injections. Finish off as a closing speaker for the Third International Psychiatry and Addiction Masterclass, the IPAM in short, today. It's been a great forum where new ideas have been exchanged. There've been learning to and fro between clinicians who are attending and also the speakers in the chairs. There's been immense discussion about newer ways of working, newer type of treatments that are out there, and there's exchange of immense knowledge between a number of clinicians from a variety of backgrounds for both our speakers and attendees. And I think a forum like this is absolutely essential to further that, to further the knowledge, and to be able to disperse this knowledge wide and through. The most essential point is people need to take the learning points from our session about newer types of treatment and the other types of innovations that are out there, and to see whether it can be implemented within their own services. I've spoken at many conferences across the world in a variety of settings on different themes. When I started planning for the Third International Psychiatry and Addiction Masterclass, I came across Convensis. What I liked from the beginning was their transparent method of planning out, their very clear communication, an organized way in which they approached a professional conference like the IPAM, and the process that was behind the whole setup for arranging this high-quality conference. Their insistence on making sure the quality is not compromised from beginning to the very end, and it's been an absolute brilliant experience with them, making everything so smooth that I wasn't stressed at all, which is unlikely for any conference organizer. And I arrived on the day in the morning just to be handed over what needs to be done by myself. So without even thinking twice, when we're planning the 4th International Psychiatry and Addiction Masterclass, we would be most probably collaborating very happily with Convensis again.